This is Dr. Kim Lee, child psychiatrist, and today I've got some tips for any health advocates out there. And if you're a medical doctor, you are definitely a health advocate. Because in my specialist training, I was taught the CAN-MEDS framework, and one of the arms of the CAN-MEDS frameworks is health advocacy. But no one really taught me how to handle the media. And now that I'm very much within the media space, I'm having to learn on the run. So I've reached out to my colleagues, and one of those colleagues is Dr. James Muecke, former Australian of the Year, founder of Sight for All. He's an ophthalmologist and has been doing some great work to look at the sugar industry and to promote whole foods and to reduce the incidence of obesity, diabetes, blindness. He linked me to this really interesting article written by health advocate Professor Simon Chapman, who is an anti-smoking activist and campaigner. And he lists 10 tips. And now these tips are not my tips. These are Simon Chapman's tips. And the first tip is to respect the evidence and to make sure that the foundation of your health promotion is clear evidence.
A lot of people would see it as radical. Is it the right move to be telling people what they cannot do as far as smoking is concerned?
Look, 95% of people who smoke regret having ever started, and about 40% try to quit each year, and a vast majority of them fail to do so.
It's a debate back in 2012 when the cigarette industry had lost a high court challenge to campaign against plain packaging for cigarette packs. Now, the second lesson by Simon Chapman is to make sure you study the media and understand how the media works and how the media cycle works. And he was always available to be the go-to guy with his clear messages to radio, TV, social media, and he knew exactly what he was doing with the media. He was an absolute wizard and a real inspiration to me, and he would drop anything to make sure that he got his word out there to promote anti-smoking. Lesson number 3, or tip number 3 from Simon Chapman, is to grow a rhinoceros hide. As a medical expert, health advocate, campaigning or anti-industry, you're gonna get some criticism and some pushback from the industry interests to protect their financial interests. And so Simon expects this with his opponent in the debate in this TV segment and deals with it brilliantly.
Now that's an extraordinary position to take in public policy. If the group is small enough that we can persecute it easily, then we should do so.
Yeah, well, I think what we have to understand is that James's organisation, the Institute of Public Affairs, is basically just a sort of a voice for the tobacco industry. They are funded by them. They've admitted it recently. So he's just sort of running errands for his employers at the moment. And I think we need to understand what he's saying in that context.
Lesson number 4, make sure you use killer facts. Killer facts act like earworms. And Simon says that earworms, once they get in, they're very hard to get out. So they're very sticky messages. And one of the quotes that he uses is, public health is saving lives, 1 million at a time. And so he uses a killer fact at the end here to complement his overall argument for this ABC interview brilliantly.
It says a lot about your evidence.
The facts are that 15,000 Australians die from tobacco each year in this country, 5 million around the world, and that the errands that your organisation's running for that industry are really quite despicable. And, you know, that's the sort of fact that I'd like to leave viewers with.
I hope you enjoyed my video today. If you have any other health advocates, if you're a health advocate, link me. I'd love to hear your story. I'm looking for inspiration. And this is only part 1 of Simon's top 10 tips. If you really want to see the 10 tips right now, I'll link you the article in the comment section. Thanks again. Take care.